welcome again. I am Obane Kestin, and I will be taking you on the subject physical and health education. We are looking at the topic pathogens, diseases, and their prevention, part 6. Now, by the end of the lesson, you should be able to define non-communicable diseases, explain the nature of some of them, as we are going to be seeing in this lesson, and state their causes, disease factors, treatment, and prevention. Non-communicable diseases, as we've established, they are diseases that cannot be transmitted from person to person. They are usually long-lasting or constantly reoccurring. And we say we have a wide range of ailments that we can call non-communicable diseases. Some examples are cancers, autoimmune diseases, diabetes, cardiovascular diseases, fractures, osteoporosis, stroke, etc. So we'll be looking at stroke. I'm sure you would have heard the word stroke, okay? People coming down with the disease, stroke. What does it actually mean? Stroke is a condition in which brain cells die due to insufficient blood flow to the brain. The blood, as we know, the blood in our body flows to every part of our body. In fact, any part of our body that blood is cut off from, that part will actually be damaged because it is the blood that also carries oxygen to different parts of our body. So any part of our body that lacks blood, and by extension lacks oxygen, that part of the body would suffer damage. Now we're saying that stroke is what? A condition in which the brain cells die due to what? Insufficient blood flow to the brain. So when blood does not flow sufficiently or enough to the brain, it will lead to the death of brain cells. And when brain cells die, it leads to what? Stroke. Stroke can also be described as damage to the brain caused by the interruption of blood supply to the brain cells. When the supply of blood to the brain cells has been interrupted by anything at all, it will lead to what? Stroke. Now, when these brain cells are deprived of the needed oxygen, remember that blood carries the oxygen to every part of the body. But it's not only oxygen it carries around, it also carries glucose to the parts of the body that needs it. So when these brain cells that need the oxygen and glucose are deprived of the needed materials, this oxygen and glucose, for their survival, what will happen? They will die. Thus, the part of the brain affected will no longer function properly. So that part of the brain cell that has been affected, that lacks sufficient oxygen, sufficient glucose, that part of that brain affected would what? Die. Our brain has different function. It has different connection to other parts of our body. The parts of the brain cells that are no longer functioning properly would also affect those parts of our bodies connected to that brain cell. Now, stroke is a medical emergency which, if not treated on time, can result in permanent brain damage or even the death of the individual. Now we can see from our image that there is an interruption here. There is a blockage stopping blood from moving from this part, okay, to the other side of the brain cells. So this blood is unable to pass due to this interruption in the middle here. So the brain cell affected will be damaged. Now this can lead to what? Permanent brain damage or death of the person. Now we'll look at types of stroke. We have two major types of stroke in existence. They are ischemic stroke and hemorrhagic stroke. Ischemic stroke, this type of stroke is caused by a lack of blood flow to the brain due to blockage of what? A blood vessel. So when a blood vessel has been blocked in the brain, blood can no longer flow through that vessel to other parts of the brain that needs it. So here is an image showing us what happens with ischemic stroke. This is what the blockage. So blood can no longer flow across from this point to the other parts of the brain cells. So blood is forced to flow back. So ischemic stroke is a kind of stroke that is caused by what? Blockage of a blood vessel. Then we have hemorrhagic stroke. This type of stroke is caused by bleeding directly into the brain or bleeding into the space between the membranes of the brain. So this is when people bleed in their brain. This gives rise to what? Hemorrhagic stroke. Now, signs and symptoms of stroke. Some signs and symptoms of stroke are sudden, severe headache without a known cause. Someone begins to have headache out of the blue. It's not like he was sick before. Sudden headache. Loss of vision in one or both eyes. Paralysis or numbness on one part of the body. This could be on the face. Sometimes you see people that have suffered stroke before. You see a part of their face drooping down. Okay? It can also be numbness or paralysis of the arm. They cannot use their arm or their leg. Some of them, a part of their body just gets paralyzed. Maybe the right part of the body, depending on which part of the brain the blood supply was cut off. Okay? It can affect the right part of the body. It can affect the left part of the body. Another one is loss of speech or difficulty talking or understanding what others are saying. Another one is instability to walk or loss of balance. Now, these signs and symptoms are usually observed in patients diagnosed with stroke. So, you see that this happens when someone has already come down with stroke. We have a diagram here portraying the different parts of the body that stroke usually affects. We have the face. Okay, so this is how to recognize a stroke patient. One part of the face, as you can see, is longer than the other part of the face. The arms, the person may not have control of the arms anymore. Also, the speech may be slurred. So these are different signs of stroke. Now we have risk factors for stroke. I said risk factors are those things that increase people's chances of developing a certain disease. One risk factor of stroke is high blood pressure. People that already have high blood pressure are at a very high risk of developing stroke. Another one is tobacco smoking and excessive alcohol intake, obesity, high blood cholesterol, diabetes mellitus. So you see, from one NCD, people can also develop other NCDs, okay, or non-communicable diseases. You can even have diabetes, and then the next thing is giving rise to stroke. Or you can have obesity, and the next thing is giving rise to diabetes, or is giving rise to stroke. So we must make sure that these risk factors are greatly minimized. Another one is if someone has had a previous transient ischemic attack, TIA. This TIA simply means a brief stroke-like attack that resolves within minutes to hours. So sometimes someone may have some of the symptoms that look like stroke, but it doesn't last for a very long time. Stroke lasts for a long time, but this transient ischemic attack does not last for a long time. But we're saying that if people have this kind of attack, this TIA, there's every possibility that such people that have had such what we call mini strokes can actually go on to have full strokes. Then another risk factor is atrial fibrillation. This is an uneven rapid heart rate that results in poor blood flow. Okay? Now we have complications of stroke. Complications of stroke may include pneumonia or loss of bladder control. Such a person may be prone to pneumonia, and the person may lose their bladder control. So you see them urinating unconsciously without them, having control over their bladder. What can we do to prevent stroke? The most useful prevention for stroke would be to avoid or decrease those risk factors associated with it. There are other preventive measures against stroke, and they include taking aspirin or carrying out surgery on people with what? Problematic narrowing of the carotid artery. Such people can take aspirin to what? Open up this carotid artery so that blood can easily flow. Also, people with atrial fibrillation can be given warfarin. Warfarin most times is in tablet form. Now, this warfarin is a medication used as an anticoagulant. We've mentioned that blood vessels can actually be blocked, causing blood not to flow from parts of the body to the brain cells, okay? And this can lead to what? Stroke. But this warfarin is a medication that is used as an anticoagulant to remove some of those clots that has formed in the blood vessels. And when they are removed, then blood will easily flow to the brain. So we can see in this image, we have here a stroke-causing blood clot. And with the aid of warfarin, it removes that clot. It's no longer there. Now blood can flow freely from one part of the body to the brain. So warfarin is an anticoagulant or blood thinner commonly used to treat blood clots and to prevent stroke. Now, these treatments are done in order to effectively allow the flow of blood through the arteries to the brain. Treatment for stroke. Stroke, once present, cannot be cured, but then it can be managed. Immediate treatment can help save a patient's life and increase the chances of full recovery. When you see someone who is behaving or acting as though they are already having those signs and symptoms of stroke, the best thing to do is to quickly take such a person to a hospital, because early treatment is very important. It can help the person recover fully from those symptoms, and late treatment can even cause permanent damage of parts of the body. Early treatment will require the following: the use of medications such as what we call TPA. Now, TPA is a clot booster. It helps to reduce damage to the brain. Other kinds of treatment are centered on limiting the complications from stroke and preventing its reoccurrence. Surgery can also be done for people with hemorrhagic stroke. Now, if ischemic stroke is detected within 3 to 4 hours of its occurrence, it can be treated with a medication that can break down the clot. Example, aspirin. So if it's ischemic stroke, remember we said that ischemic stroke is a kind of stroke where there has been a blockage on the blood vessels so that blood cannot flow freely to the brain. So if it is what has been detected, aspirin is one medication that can help to break down that clot in the blood vessel to allow blood to flow. Now, a treatment called stroke rehabilitation sometimes is performed on patients. It is done in a stroke unit. Now, this stroke rehabilitation is done to restore the normal functioning of body parts that has been damaged due to the disease. So people that have already had issues with their body parts, maybe drooping face or numbness, paralysis of some parts of the body, treatment can be done in this stroke rehabilitation unit in order to restore normal functioning of the body part that has been damaged. This kind of treatment is, however, not available in most parts of the world. The next NCD we are going to be talking about in this lesson is osteoporosis. Now, this is defined as a bone density of 2.5 standard deviations below that of a young adult. When someone has a bone density of 2.5 standard deviations below that of a young adult, now osteoporosis is a disease that mainly affects people of older age. So as people grow older, their chances of developing osteoporosis becomes higher. It affects older women more. It can last for years or even a lifetime. Osteoporosis is known as porous bone, and it's a condition characterized by low bone mass and high bone loss. The body works in such a way that it constantly absorbs old bone tissues and replaces them with new ones. It is not only the bones that get replaced in the body. So our body works in a way that it constantly absorbs the old bone tissues and replaces them with what? New, healthy ones. But in the case of osteoporosis, the rate that the body produces new bones does not measure up or match up with the rate of removal of the old bones. Now, this causes the bones to become weak and what? Brittle. As you can see here, a case of someone with healthy, strong bones and someone with brittle bones. See a healthy bone mass. You can see how healthy it looks, okay, because the rate at which the old ones are being removed matches up with the rate at which new bones are being formed. But in the case of osteoporosis, we can see that what? These bones are quite hollow and brittle. There are lots of what? Open spaces. So such bone will be very, very weak and brittle and can easily break at the slightest pressure. Now, people with this condition, osteoporosis, they experience what we call bone weakness and breakage from any minor fall or accident. Because their bones are already weak, okay? Any little thing that happens to them, the bone breaks. They easily have fractures. Bones that commonly break are the vertebrae in the spine, bones of the forearm, and bones of the hips. So we can see how the chances of people developing osteoporosis increases with what? Age. All right? So see someone at age 40 with normal bone mass. See another person or a lady at age 60 with reduced bone mass. And we can see someone at age 70 has already had the disease osteoporosis with the disease itself at full play. And we can see their body shapes. At 40, she is very, very straight because her bones are still all strong. At 60, you see that she begins to experience curving at the spine. You see that the head and the shoulders are stooped, they are bent. And then at age 70, such a person begins to what? Bend very much. So osteoporosis has set in. Now, what are the signs and symptoms of osteoporosis? Increased weakening of the bone tissues may lead to breakage of bones from very minor stress. So this is one sign of osteoporosis. Many people with this disease do not experience any other symptoms at all until they have a broken bone. So the major thing that signifies that someone has osteoporosis is what? A broken bone. The person may not have headache or other kind of signs and symptoms that shows a certain kind of disease. But you notice osteoporosis, especially when the person is aged and the person always experiences bone breakage at the slightest pressure or accident. Symptoms such as chronic pains and decreased ability to carry out normal activities involving the limbs occur following a broken bone. Of course, when the bone is already broken, the person will definitely experience pains, and the person will also not be able to carry out normal activities that involves the limbs. Activities that will require the person maybe to carry loads or even to walk. So you see some of them assisting themselves with walking sticks or even being on a wheelchair because the bones of their limbs simply mean the bones of their hands and the bones of their legs can no longer carry their everyday activities. What are the risk factors for osteoporosis? So we'll see some risk factors for osteoporosis. One risk factor is low sex hormone levels. When people, especially women, have low sex hormone levels, it can lead to osteoporosis as they age. Inactivity or sedentary lifestyle. We've said that inactivity, sedentary lifestyle plays a very big role in the onset of a lot of non-communicable diseases. Certain medications or treatments which increase the rate of bone loss there are certain medications that cause people to lose bone mass. So, for example, anti-seizure medications, proton pump inhibitors, and even chemotherapy can lead to increase in bone loss. Another risk factor is smoking and alcoholism, then menopause. Menopause leads to the production of lower levels of estrogen. As we said, low sex hormone is one risk factor. So sometimes when women go into menopause, their sex hormones begins to also decrease. Then we have surgical removal of the ovaries. This is another risk factor. Then we have certain diseases such as rheumatoid arthritis, kidney diseases, gastrointestinal diseases, and hyperthyroidism. These are certain diseases that can increase people's chances of developing osteoporosis. What are some preventions of osteoporosis? Proper diet. Diets rich in calcium and some other important minerals that help with bone formation in the body. Avoiding medications that may cause the conditions to arise. There are certain medications that may cause this osteoporosis to arise. Such medications must be avoided. Then another prevention is proper exercise. There are exercises we call weight-bearing exercises. These kind of exercises help with what? Bone. Helps to make the bone very strong and healthy. As you can see, you have some of these exercises that has to do with lifting dumbbells with the hands. Okay. Another one is jogging or running. It helps to strengthen the leg bones. And then we can see also standing hip extension. Another kind of exercise that can help to strengthen the bones. Another prevention measure against osteoporosis is to stay away from smoking and alcoholism. Very important. Now, the treatment of osteoporosis. Osteoporosis cannot be cured, but some treatment can be given to help manage the disease. These treatments would include the use of medications, example, bisphosphonate medication. This kind of medication is used for people with this condition to help them with what? Their bone mass. Another treatment would be to maintain a healthy diet. As we said earlier, eating diets that are rich in vitamins and minerals, those minerals that assist the healthy formation of bones will be very, very needed in diet. Then lifestyle change. If the person already takes alcohol or uses tobacco, the person must quit smoking and quit the use of alcohol as well. The person must engage in weight-bearing exercises. Now, this helps to prevent bone loss or to strengthen bones that have been weakened already. And then, one final thing to avoid is what? Falls. Such people must avoid falls or avoid putting themselves in position that will make them carry heavy weights that can cause the bones to break. So with this, we have concluded on some non-communicable diseases. In your spare time, you can research, find out about other non-communicable diseases and how they can be prevented. We are going to be looking at the role that our community, our government can play in combating or fighting non-communicable diseases. Now, statistical studies have shown that most non-communicable diseases are associated with poverty and socioeconomic deprivation. NCDs are more prevalent in countries or regions that have high rates of poverty, where also people's socioeconomic rights and privileges have been deprived, where people cannot afford to eat the necessary healthy meals, okay, or have conditions necessary for them to engage in healthy practices. It has also been shown that a good percentage of people who suffer from these diseases come from low and middle income countries. But 80% of NCDs are preventable when the right tools for their prevention are put in place. Now, some of the ways that our communities and the government can help to fight non-communicable diseases are: 1, regulation of advertising, stating the side effects of some substances. For example, we have advertisements on some kind of alcoholic drinks and tobacco smoking. Such advertisements should also state the side effects of these substances, especially when they are taken in excess. Another thing that our communities and the government can do is to provide access to healthier foods. A lot of people do not have access, especially poor people or low-income earners. They do not have access to healthy foods. One way they can improve access is to make these foods available by improving on agricultural practices, making sure that these foods are available. And they are not just available, they are also available at a cheap rate for people to be able to afford them. The governments and our communities can also put measures in place to reduce the risk of being exposed to poisonous gases in the environment. They can also put measures in place to alleviate poverty and improve the socio-economic conditions of citizens. Things must be put in place to alleviate poverty and improve the socio-economic conditions of the citizens. Our communities and government must also encourage physical activities, encourage people to engage in physical activities. They can also improve access to medications available for the treatment of non-communicable diseases. They should also have medical staff readily available to render medical services to citizens. So we'll just take a summary of what we have learned. We said that stroke and osteoporosis are some examples of non-communicable diseases. And then in the course of our lesson, we learned that stroke is a condition in which brain cells die due to insufficient blood flow to the brain. We also talked about 2 types of stroke. We said that they are ischemic stroke and hemorrhagic stroke. Then we looked at osteoporosis, another non-communicable disease. We defined it as a bone density of 2.5 standard deviation below that of a young adult. Then we also said that osteoporosis is also known as porous bone. It's a condition characterized by low bone mass and high bone loss. Then we also looked at some measures that the government can put in place to control non-communicable diseases. Some of them are regulation of advertising, stating the side effects of substances, improving access to healthier foods, improving access to medications available for the treatment of non-communicable diseases, putting measures in place to reduce exposure of persons to environments with poisonous gases. So with this, we'll just take a few questions. The first question says, a condition in which the brain cells die due to insufficient blood flow to the brain is known as A, cancer, B, diabetes, C, stroke. The correct answer is C. We've learned in our lesson that stroke is a condition in which the brain cells die due to insufficient blood flow to the brain. The next question says, in which of the following ways can communities and the government help to fight non-communicable diseases? A, creating awareness on birth control. B, providing good transport facilities. C, improving access to healthier foods. Our answer is C. We said in our lesson that when access to healthier foods are provided by our government and by the communities, it will help in the fight against non-communicable diseases. So with this lesson, we've wrapped up our lesson on pathogens, diseases, and their prevention. Thank you very much for staying with me. You can go ahead to take a look at our lessons from the first part of this lesson to the last part of the lesson to have a better understanding of all we have learned. Thank you for staying with me.